when you open the door for somebody else.
Welcome back, everybody, to the Vaccine Conversation podcast with Melissa and Dr. Bob. We are super excited to be back. I mean, to you, you probably just listened to the last episode yesterday, and so to you, we didn't go anywhere. But to us, I don't know, it's been a couple weeks.
It's been a couple years. How are you?
I know.
Seriously.
You look amazing. You haven't aged. You look like you've aged 2 weeks.
It's this new moisturizer I'm using. Just kidding. No, sometimes we record a couple episodes back to back, and then we don't do it for a couple weeks, and it's hard to get our schedules coordinated, honestly.
Yeah. And thus the one episode a week we've been putting out for the last few weeks.
You're dropping the ball.
I know.
Bob. Honestly, just dropping the ball. I hope everyone really enjoyed our last episode with Nico LaHood.
Yeah.
Which was really cool and a very different angle, which is, looking back, I love all of our interviews. You know, it's been really, really cool to see the kind of people we've brought to the podcast and hopefully continue to do. I have a whole list of people I'm interested in, one of which is Bob Sears.
Okay.
But he is impossible to get a hold of. I have sent 4, maybe 5 emails.
Yeah.
And nothing.
I hear he doesn't even answer his own emails. He has people that check his emails for him.
While he's like vacationing in Aruba or something.
Yeah, totally. Yeah.
Well, hopefully his assistant gets back to me at some point, because I would really like to get his perspective on this debate.
Yeah.
So listeners, maybe that's coming in the future. Fingers crossed. If anybody has a connection, a direct connection to Dr. Bob Sears, let me know, and we'll see if we can make it happen.
I am looking forward to that, though. In all seriousness, I know you and I have been talking about, I guess you kind of like interviewing me, like you've interviewed some of the other guests, and just kind of asking me maybe some of the tougher questions, maybe kind of getting to the root of some of my beliefs and opinions. And so I don't know, I welcome that.
Do you get to like lie down on a couch, and can I like use like something to hypnotize you and say, tell me what happened when you were 3? Like, can we start? Is that what we're going to start? Are you going to be crying during the episode?
I will, of course. Yeah. But anyway, that'll be in season 3 sometime.
All right.
Because I kind of feel like we're nearing the end of season 2-ish. You know, we're almost at 100 episodes. So I don't know. I feel a break coming up. Maybe not quite until we hit 100, but we'll see.
What I do know is, based on what we're about to announce now and kind of talk about, we will not be able to be slacking on these podcast episodes, because here's what's going on. So there's Corona panic, that's happening everywhere. And we talked about this in a couple episodes ago before, when it was first starting. Now it's turning into federal and state action steps, which include regulating public gatherings, in some cases just at 100 people. And what does that mean for us? Well, we have our national podcast tour that is supposed to kick off in 2 weeks in Texas. And of course, every one of our gatherings is going to have over 100, over 150, over 200, over 250. In some cases, it might be 300 to 400 people. And because of the panic and because of the potential of regulations, what we have begrudgingly decided to do is to postpone the first 6 locations on our tour.
Right.
So anything on the podcast tour that was March or April is going to be pushed back to the end of summer, early fall. We are not canceling them completely, of course.
Right. And you can keep your sign up. Keep your registration, sign up, keep your tickets already. We'll just be using the same Eventbrite pages, just changing the dates.
The dates and possibly the venues.
Right.
They might change, but so far we're trying to make sure we're at the same venues. We have more notice now to be able to book those in advance. So let me just, again, highlight really fast what this means. It means San Antonio, Dallas, Nashville, and Alabama. And in addition to that, Washington and Oregon. So all 6 of those locations, we are going to push you back a little bit. We're still going to see you, but we're going to push you back. So don't worry. The Washington date has been set. The rescheduled date is now going to be July 18th. And we are going to have an Oregon date, either the day before or the day after. Haven't decided yet. And we have a great team on the ground in Oregon that's getting that set up. That's going to be in Portland area. So if you were kind of disappointed that we weren't going to come to a major city center for Oregon the last time around, you'll be happy to know that we're going to be in the Portland area, accessible to everyone, and look forward to seeing all of you. It's a great group out there in Oregon for medical freedom.
Yeah, and I just want to emphasize, I will still be attending the immunity conference
as of now.
Right, as of now, if it goes forward. So the end of April 26th.
That's in Ashland, Oregon.
Yeah, Ashland, Oregon. There is a healthy immunity conference. It's like 2 days. A bunch of us are going to be there. I'm speaking there. So as long as that event goes on, I will definitely be there and look forward to seeing all you guys. We just will not be doing our podcasting event that evening, that Sunday
Even
evening.
though Dr. Bob suggested he should. He suggested yesterday, you guys, that what if, it's okay if you're not there, Melissa. What if I just record something out there anyway? I was like, oh, the horror, blasphemy.
It sounded like such a good idea,
Oh,
right?
my goodness.
No, but I think, you know how you send a text and you're like, oops, can I get that text back somehow? Because that seems like a really foolish idea.
There was no unsending that.
So I knew that before you informed me how foolish that idea was, just so you know.
Well, so I just want you to know if somehow I disappear off of this podcast, it will have been by design, and Dr. Bob will kill me off of the show, and I won't be returning for additional seasons. It could happen, guys. Just know it wasn't my choice. It wasn't my choice.
It'll never happen.
So okay.
Could you guys imagine just listening to me talk for an hour?
Let's try it. So I really hate the fact that we have had so many scheduling changes. I know it's really annoying that you have to hear on the podcast, here's our update. But you know what? As any parent knows, this is life. We have to be flexible.
Mm-hmm.
We have to adapt. Things change. In this movement, things change a lot because we do really require and rely on a lot of people to volunteer their time and effort.
Mm-hmm.
And when you do that, it gets really hard to make everything solid all the time, way far in advance. So a lot of this is go with the flow, but we're making it work. We're hitting all these places and we're going to fill them up, and it's going to be crazy amazing. And the events are going to be awesome.
Yeah, and you can just, keep track on our website, immunityeducationgroup.org. There's a podcast tour dates tab at the very top. That will be where you will find the official information and dates and new new venues if they change. And so, stay tuned there. And that's where you'll
and I'll give you an outline. Here's the outline. So basically in May, we're going to hit SoCal. So that's definitely going to be happening. In June, we have New Jersey and Connecticut still on the books for the 19th and the 20th. In July, like I said, 17th, 18th, 19th, somewhere around there, we're going to have Washington and Oregon. In August, we're going to look to try to get an event for Michigan and Wisconsin in the middle of the month. We've got a few weekends in the fall, the end of September and the first 2 weekends of October, that we are going to try to get all of the rest of the places in there that we had to reschedule, including Texas, including Tennessee, Alabama and Georgia, and maybe Illinois, if we can work that out. I know you guys have been asking for us. Florida, I'm still thinking about you guys too. We're trying to figure out how we can make this work. And hopefully we'll be able to end up at the beginning of November, Northern California to finish it off. We're doing our best to get to everybody. But so now it looks like it'll basically be May to November instead of, March to fall like it was before. So anyway, we make it work, and we'll keep you updated. Check immunityed.org, the podcast tour information, and I'll keep posting about it on my page, like whenever we're getting close to a time. And if you have any questions about these dates, just message me on Facebook, or message us on Immunity Education Group Facebook page if you're uncertain about whether or not we're coming to you and when that's happening. So we're going to make it happen. Just have to be flexible.
Yep.
Anyway, that was our update again. That was like update number 4 on the.
Yeah, and I can't believe, the amount of work you've poured into this yourself. I think it's, is amazing. And I feel bad that this has happened basically to our whole country. We're all dealing with this. And you and I, we don't have any personal fear of coronavirus itself. It's just the reality of how, the whole country is approaching this. And I think we want to be responsible and respectful of that. But we are so looking forward to this. And I guess, all the work we put in, it hasn't gone to waste because we're doing all the same things. It's just
a different day.
Just change the day. So anyway, we are so looking forward to seeing you guys. So hang in there. And what is...
And who knows? I might have even had coronavirus. It's like, you don't even know. It's like, we don't really know. Like a lot of people that have been sick over the last couple of weeks, even a month ago, I think there's really no way to know whether or not that's what it was for people.
Yeah. And even though I'm not afraid of it, like I feel like every kid that I'm now seeing just with a cold, a cold and a cough, that could be coronavirus. It's not like I can gown up and put on the face mask and the sterile gloves and the gown and see every patient that way. So I almost feel like it's inevitable that every, healthcare personnel is probably going to, come across it, contract it. I'm still young and healthy. And,
well, like we talked about in our last episode on coronavirus, we talked about how kids are just really unaffected by this. We're not seeing complications. We're not seeing deaths. This is really affecting older adults, and usually with underlying health conditions. So it's like, again, like anything else, the goal is to keep yourself healthy, not to treat coronavirus. You want to make your body so healthy that if you were to catch coronavirus or influenza or anything else, that you would do so and weather it without complications. The goal comes down to making your immune system strong.
And I'd been taking this Nature's Organic Tonic thing, from Jocelyn. And I cut back to like every other day or every 3 days dosing just to kind of space it out. But I'm totally back on every day now. Oops, there's my Instagram fired up. I'm back on everyday dosing now just because I feel like, I need to be at peak health for not if I'm exposed. I almost feel like when I'm exposed, then it'll just be like a nice mild case. I might have to I'll have to take a week off of work or something.
Well, people remember if it's your kids could literally have almost no symptoms because kids handle this a lot better. So I know people are worried about their children, but really it's the kids that are the safest in the, tens of thousands of cases that they've seen. Kids are just not affected. Both of my kids had like a 1-day fever and then
from something.
The same thing it was pretty harsh for me though. It was much stronger for me. They weathered it way faster. And then of course my youngest had one day of fever and that was it. And then Serenity had the 1 day of fever. And then a couple days later kind of had a little cough come. So I've heard that described from people that were tested positive for it, but she had really nothing else other than that, like nothing that kept her down and out. So, I mean, I know everybody's panicked about this, but for the most part, this could literally just be something that passes like a cold and that you don't really even, it's not devastating for everyone. I know the media is making this like it's all devastating, but you might have already had it in your family. It might have already passed through and you didn't even know that's what it was.
Yeah. And I want to read something really quick just since we're on coronavirus. It was pretty encouraging to me. It was written by an infectious disease medical doctor, someone who's been doing this for 20 years. And if I just, really briefly read this, I mean, this has been a doctor who's been dealing with both in the United States and Africa, every possible outbreak there's ever been, for every serious infectious disease. He writes, I am not scared of COVID-19, coronavirus. I am concerned about the implications of a novel infectious agent that has spread the world over and continues to find new footholds in different soil. I am rightly concerned for the welfare of those who are elderly, in frail health or disenfranchised, who stand to suffer mostly and disproportionately at the hands of this new scourge. But I am personally not scared of coronavirus. What I am scared of is the loss of reason and the wave of fear that has induced the masses of society into a spellbinding spiral of panic, stockpiling obscene quantities of anything that could fill a bomb shelter adequately in a post-apocalyptic world. I am scared of the N95 masks that are stolen from hospitals and urgent care clinics, where they are actually needed for frontline healthcare providers, and instead are being donned in airports, malls, and coffee lounges, perpetuating even more fear and suspicion of others. I am scared that our hospitals will be overwhelmed with anyone who thinks they probably don't have it, but may as well get checked out no matter what, because you just never know. And those with heart failure, emphysema, pneumonia, and strokes will pay the price because the ERs are overfilled and they can't get in. I am scared that travel restrictions will become so far-reaching that weddings will be canceled, graduations missed, and family reunions will not materialize. And, well, even that big party called the Olympic Games, that could be kiboshed too.
That's right.
Can you even imagine? I'm scared those same epidemic fears will limit trade, harm partnerships in multiple sectors, business and otherwise, and ultimately culminate in a global recession. But mostly, I'm scared about what message we're telling our kids when we are faced with a threat. Instead of reason, rationality, open-mindedness, and altruism, we're telling them to panic, be fearful, suspicious, reactionary, and self-interested. Coronavirus is nowhere near over. It'll be coming to a city, a hospital, a friend, even a family member near you at some point. Expect it. Stop waiting to be surprised further. The fact is, the virus itself will not likely do much harm when it arrives, but our own behaviors and our fight for yourself above all else attitude could prove disastrous. I implore you all, temper fear with reason, panic with patience, and uncertainty with education. We have an opportunity to learn a great deal about health hygiene and limiting the spread of innumerable transmissible diseases in our society. Let's meet this challenge together in the best spirit of compassion for others, patience, and above all, an unfailing effort to seek truth, facts, and knowledge, as opposed to conjecture, speculation, and catastrophizing. Facts, not fear. Clean hands, open hearts. Our children will thank us for it.
Yeah. And he's talking about not just this, but anything that comes out.
Right.
I mean,
yeah, I think that speaks to our, how our whole society approaches infectious disease outbreaks.
but again, what happens is everybody looks to treat it. Oh my God, coronavirus is here. What do I do for coronavirus?
Right.
What vaccine is there? What medication is there? What do I take? This is kind of how our society looks at health these days. Here's a problem. What do I take? Nobody's looking at how to prevent the problem.
Right.
Like in the first place.
Right.
Prevent the problem. Work on health all the time. Make sure health is a priority to you. Why aren't our agencies, our government agencies, really focusing? I mean, yeah, they're talking about washing your hands, but why aren't they talking about things you can do to boost your immune system like vitamin D? Why aren't they talking about reducing sugar? Why aren't they talking about eating fruits and vegetables and staying away from processed foods, making sure you're getting a sleep routine, reduce stress, stay away from really crowded areas if you don't have to? I don't understand why that's not even part of this conversation. I've not heard any footage that talks about how to make your body strong. It's just wash your hands, use a mask, and hopefully that vaccine will come out sooner rather than later. This is all what you do after the fact, instead of really trying to get your body to a place where it can handle any type of germ that comes to it without a problem. I mean, it's beyond me that as a society, we're not guiding our members to sort of live healthier lives by teaching some of the things that are tried and true that people know, can improve our health. They're not talking about that at all.
Right.
It's just panic, and this is why it can get so out of control. And I've seen people posting going, I bet anti-vaxxers, this is what it's going to look like when all the diseases come back that anti-vaxxers want to come back. Right. They're like, see this panic that's happening. Somehow people have found a way to take the coronavirus issue and bring it right back to this is the panic. Now, anti-vaxxers, now do you understand like why you need to get all, your children fully vaccinated and whatever? It's like those two things really don't go together. This is not, that's not the conversation we're having. As we've heard from the congressional hearings, a vaccine will not be available for the public between 12 and 24 months. Right. This is according to Peter Hotez and Dr. Fauci.
Yeah, and they're trying to fast track a vaccine, but that still has to go through the process
the clinical
of
trials,
testing to make it work and get a safety profile on it.
But in that congressional hearing, Peter Hotez, and we should probably do a podcast on it because it's pretty interesting. He's really a doomsday guy. Like he really tries to paint a picture that the world is ending. And this is not the first time. He's done this with like each year with whatever it is, Ebola or whatever it is. Yeah. And so he was complaining about how much time it's taking to be able to get a vaccine in development. He was almost pushing the fact of maybe if we could get you guys to override some of the current rules and regulations, then we could get this out to you faster.
Was that Dr. Hotez?
Yeah. Because coincidentally, did you know he has a vaccine for coronavirus he's putting in the market? Oh. Isn't that funny? Wow. Considering he's usually working in a completely different field, right? He usually works with like intestinal viruses or whatever in the Amazon. Or
international parasitic diseases.
He's doing something totally different, right? Yeah. Coincidentally, him and his team have a vaccine ready to put into the pipeline, and he said there'll be about 5 others. So there are going to be about 5 or 6 of them that are put into, and then he said, and then it's just going to be traffic. They're going to be stuck in this place where it's going to take time. And he was irritated with the time. He's like, we're going to have to test it on people and make sure it's safe. He said it in a way that was like,
wow.
he was kind of irritated with. And so they're definitely pushing.
Yeah, but this outbreak's going to be over by the time a vaccine's even here. And, we're going to move on from it. It's going to be temporary. This is not the kind of disease that takes hold in a society and then keeps recirculating every year like the flu.
You don't think? 'Cause
No,
I've heard
it's
some
not.
people estimate that's what's going to happen.
I don't think so, because if you look at SARS and MERS, the 2 previous
Came and went.
coronavirus outbreaks, they both came and went. So I don't know. I can't predict the future.
I wonder if they're going to, even if, let's say, it comes and goes, they'll have the vaccine available. And then I think what'll happen is anytime there are 50 cases or 100 cases, they're going to go, remember what happened in 2020? We don't want that to happen again. So everybody should go out and get their vaccine. They'll find a way to still probably connect it.
I want to just, I guess, since we're on this subject, this was supposed to be a little introductory thing on coronavirus, but what a lot of patients are asking me in the office is, my kid has a cough, a fever, and a runny nose. Should I come in and be seen? Should I go get tested? Do I need to worry? And the answer to all 3 of those questions is no. The CDC is actually saying, if you have cold symptoms, don't go anywhere.
Right.
Stay home. Your doctor cannot test you for coronavirus in his or her office right now. Doctors cannot test you. Let me repeat that. You cannot get tested in a doctor's office. The reason is the doctor won't even have a test. The doctor will take a nasal swab. The doctor can only send that to a handful of select laboratories right now. But the laboratories are only allowed to test specimens that came from a patient who was part of a known exposure, a confirmed exposure in an isolated quarantine area, or somebody who's like in severe respiratory distress in a hospital in an intensive care unit. They're, almost dying from respiratory distress, and you're suspecting it. Yeah, they'll test that. Laboratories are not even allowed to test regular healthy kids, healthy adults who simply have cold symptoms. So
Good to know.
So don't even go to the doctor to ask for a test. Don't go to the doctor. Your doctor can't look at you and know whether or not it's coronavirus. And so again, if you have cold symptoms, stay home. And this would be the time to not send your kid to school with a cold.
For sure.
I mean, most people, you go to school if you have a cold. You go to work, you have a cold. Maybe
I don't. I mean, we don't.
Right. But most people do. And then most people think that's okay. But now with the fact that it could be coronavirus, these are the next 2 or 3 weeks to stay home in that kind of scenario whereas you normally wouldn't. Don't see your doctor. Now, if you have severe respiratory distress, or you are part of a known confirmed case exposure, then yes, you need to seek medical care. You need to, go seek help. But, stay updated on the CDC website, or even better, the public health department websites for each state are going to be a useful source of information. But that's kind of the nutshell so far at how parents should, treat their kids or themselves if they have simple cold symptoms. And it doesn't matter how deep the cough is. I'm seeing some really bad coughs from the flu and colds, really, really bad coughs.
Right.
That does not indicate coronavirus. Coronavirus is about the respiratory distress. You can't breathe. You can't get enough air. You're severe wheezing. You're breathing really rapidly. You're turning kind of little blue because you don't have enough oxygen.
And again, this isn't going to happen with kids.
Right.
Because kids aren't having those symptoms with coronavirus.
Right.
So if your kid does have that, it's probably not that, just because that's not what it's.
Right. It could be something else. It could be something else, but that's when you seek medical care. So I just thought that's kind of the main thing. I think our listeners are probably wondering right now, my kid has a cold. What do I do? And that's essentially what you don't do. There's nothing to do except stay home.
And ladies and gentlemen, those are words from a doctor, a medical doctor, a pediatrician, in fact. So this is not conjecture. This is actual good medical expertise. Brought to you live here on the Vaccine Conversation podcast.
You just said I am an authoritative source.
To them you are. To them. So today, our topic today, which isn't going to really take that long anyway, but something we needed to address, or I felt we needed to address, because I get asked this question all the time. We are going to talk today about the vaccine schedule. Just how many doses is it really? Just how many doses? I see different numbers thrown out all the time and have seen that for the last 5 years, I'd say. I continue to see different numbers thrown out. And I did an original infographic back in 2015 that was like this side-by-side list between 1983 and at that time, 2015. It was something that was in our legislator packets in California that we brought to our senators and assembly members to show them and their staff just how many doses that we have today and why there is a corresponding increase on a chart of adverse reactions that are reported to VAERS every year as well. And so historically, so we've got in the early 80s, early to mid 80s, the schedule is now, what we have now is about triple what it used to be in the 80s. And our schedule has doubled even from just the year 2000. So of course, everybody listening, or most people listening, they are aware that in 1986, and we talked about this, there was the removal of liability for pharmaceutical companies that manufactured vaccines. So they removed liability in 1986. Our schedule was about a third of what it is now. Once that liability was removed, you can actually see a linear progression of the number of doses over time. And through the 90s, and especially starting from 2000, the numbers just skyrocketed. So the question I get a lot is, one, how many doses? I keep hearing 72 or 74, or, what's the real number? And also the second question I hear is, how do you get to that number? How do you read doses? If I'm looking at the CDC schedule on their link from their website and I'm looking at this colorful PDF, how do we read that? So we're going to break down both things for you today. The first thing, how many doses? 69 doses. Okay, it's 69 doses. It was 70 doses 2 years ago. But when they removed that third dose from the HPV series, it went back to 69 doses. It's been 69 doses for like the last, I want to say 8 or 9 years. It's been about the same. Right. The big jump in that number is, of course, annual influenza vaccines. That really makes that number jump. Compared to, obviously the 80s when they didn't have that. But we have lots of doses of lots of things. And you want to read them down, Dr. Bob, so that we have them? We're going to go through each thing just briefly so that if you're at home or you're kind of writing this down and you can walk it through, you can see on our website.
Right. Yeah. I mean, I know, numbers are hard and stuff for some people, but we're just going to, I guess, kind of break it down from birth, moving on. And I think one way some people get confused is some people include the 4 pregnancy vaccinations in that number.
So that would be the flu shot and also Tdap, which are 2 different injections that now universally are advised for every pregnant woman. That's the equivalent of 4 doses. So again, big, huge thing to pay attention to. DTaP is 3 doses. MMR is 3 doses. Tdap, as you get to be over 7 years old, is 3 doses. You cannot count a single injection as a single dose because it's not. They've just combined it. And now with today's 5-in-1s and 6-in-1s, that is not one vaccine that your child is getting. It's getting 5 or 6. They just put that into one syringe. So keep in mind, as you follow along with this, and you can follow along our infographic on immunityed.org under educational tools.
Yeah, educational tools and then infographics. Right. And so I think the people that say 74 vaccines or 73, they include the pregnancy vaccines because they feel like you give the shots to mom and then that vaccine is going to make its way into the baby's immune system. So they're going to count those 4 doses as 4 things a baby's getting. We personally don't count those doses because you're technically not giving it to the baby. The baby's, not getting that injection. The baby's maybe getting the tiniest little components of that injection through the mom's bloodstream. But to me, that doesn't count as 4 doses.
And not to say that it's not affecting the baby at all, but when we talk about the schedule, we're talking about the CDC childhood schedule. So that is assuming the child has been born. And from that point on, again, not to say that the other stuff's not affecting them negatively. It's just not what we include in our totals.
Right. So the first 3 vaccines are the hepatitis B vaccine, those 3 doses. Birth 1 to 2 months, and then like 6 to 18 months or something like that is the time frame. So Hep B 3 doses, rotavirus 3 doses. One brand only does 2 doses. but the more popular brand does 3 doses. Again, that's not an injection, but it still does count as a vaccine.
It's an oral vaccine,
Right.
but it's still, each one is a dose. So those are 3 doses.
Right. So Rota 3. I'm writing these down as we go. We can add them up. Melissa will add them up really quick at the end. Hib, Haemophilus influenza B, is 4 doses, and again starts in infancy. PCV, pneumococcal vaccine, is 4 doses. All right. Polio is 4 doses. 3 during infancy, and then 1 as a booster during kindergarten.
And remember, polio used to also be an oral vaccine, but now it's inactivated as an injection to keep from creating new cases, which was what was happening with the old version. So in this version, it's inactivated, but you'll get 4 injections over your childhood.
Right. And then the DTaP, diphtheria, tetanus, whooping cough, you get 5 of those throughout your younger childhood, 3 as a baby, 1 as a toddler, one in kindergarten. And then you get the 12-year-old Tdap, essentially the same vaccine, just lower dose components of some of it. So that's 6 diphtheria, tetanus, whooping cough doses, 7 if you include pregnancy, but 6. You're correct. 6 injections of that triple vaccine. So it's 6 times 3. Melissa is 18. Melissa's the math person.
You're getting 18 doses of your DTaP series and Tdap series through your childhood. From birth to 18 years, you'll be getting 18 doses total out of your 6 different injections.
Right, exactly. Then MMR, you have at 1 year and 5 years. Measles, mumps, rubella, that's 3 vaccines in 1 injection. So you're getting 2 of those. So that equals 6 vaccines.
So 6 doses
Right.
that you're getting.
Chicken pox, you get 2 of those doses, so that equals 2 vaccines. Hepatitis A, you get 2 doses. All right. And then meningococcal vaccine, you get 2 doses as a teenager. And then HPV vaccine, you get 2 doses.
You used to get 3.
Right.
Now they're recommending 2.
Right. If you and then if you don't get HPV until you're older, like 15 and older, they do recommend 3 doses for that. But the general CDC schedule, getting the shot when you're 11 or 12, calls for 2 doses. So you add up all those numbers, and then what's left are the flu shots.
Right.
Right. And so basically
Starting at 6 months and 7 months. Remember, you're getting 2 different doses of influenza vaccine your very first year, and then after that, approximately every 12 months after that.
Right. So you're basically, the way I count flu shot doses for children, it's basically 1 a year for, I don't know if you're going to count 17 years or 18 years.
I counted to 17, I think.
Okay, so 17 doses, and then the 2 infant doses, at 6 and 7 months of age. So really, depending on how old you are, it's going to be basically roughly 19-ish doses. I think that's the number we used.
You can see this again in our infographic,
Yeah.
all listed out in a very simple linear fashion, and it adds up to 69 because they've done this like a bazillion times.
I'm counting them really quick. So 69. You're right. So 69. I think the difference is whether it's going to be 70 or 68 or whatever. That fluctuation would really come from: are you getting all 19 flu doses?
Well, also
Or are you
sometimes
getting 18 because you don't get those infant ones, or you're not old enough to get them as an infant. So, but yeah, I guess to me the most solid, reliable number is 69, based on 50 doses of everything else and 19 doses of flu shots.
I think some people are inaccurately using HPV as 3 because they haven't been updated. This changed early 2018, I think, is when we changed it. So you just have to kind of keep up with the CDC and what adjustments that they're making. Sometimes they'll have, an ACIP meeting and they'll be talking about something like Japanese encephalitis, right? And then all of a sudden everybody's like, oh, this is going to be 75 doses as of next year. But a lot of times things that they add to an adult schedule as optional are not the same thing as what's required or recommended on the childhood schedule. Now, the reason it's important to know this childhood schedule, one, as a parent, if your child is fully vaccinated or you went on schedule and just went to your well visit appointments, you might not be aware this is how much your child got, because your pediatrician is not highlighting every single one of these doses, they tend to kind of just go, oh, you have 2 injections today or 2 shots today.
Right.
And people think their child got a lot less than they did.
Yeah.
If you look at your child's records and you have followed the CDC schedule, your child was born after the year 2000, like you'll see most of these doses showing up whether you knew it or not. And one of the things, and we'll lead this into our next episode too, one of the things I find really interesting is how little parents know about what their kids are getting and then what they're requiring everybody else to be getting their kids. Like they're demanding everybody else, fully vaccinate their child, not really even understanding what that means. And we're going to talk about that in the next episode. But 69 doses, it's important for you to know this. Because you want to know what your child's getting. You want to know what your friends and family that are fully vaccinated, you want them to know exactly what their child's getting.
Right. And you want to be able to communicate this to your friends because, again, part of everyone's mission is to educate your friends when they have, new babies, young kids, and they're thinking about getting vaccines. Their doctor might actually tell them, oh, yeah, you're only getting 2 shots today. And what they don't realize, especially if the doctor is using the new 6-in-1, the new 6-in-1 is going to be DTP, polio, Hep B, DTP, polio, Hep B, and Hib, like 6 of those in one. And then the only other shot to give is pneumococcal. And then the rotavirus is like by mouth, right? Am I getting them all?
And
6,
keep in
7,
mind,
8.
You're not actually getting smaller doses of each of those when you get it combined.
Right.
So it's not like you're just getting a little bit because they put it into a multi-injection.
Right.
We're talking the same amount as if every single one of these was an individual injection, but just into one syringe. This is why it's not accurate to call that one vaccine, because it should be the number of vaccines should be exactly equal to the number of individual doses, different diseases that you're vaccinating for.
Yeah, and you'll hear a lie from some people that say if you get these 5-in-1s or 6-in-1s, you actually are getting fewer chemicals, fewer components. That is so far from the truth. These components are all the original individual vaccines that they've always been making. They just group them together, all the same chemical amounts. And the only thing you're getting less of is the saline solution that's used to dilute it all, the salt water. But everything else is the same, and maybe in some cases more. But I think it's useful for you to make sure your neighbors with young kids, your family members, show them the schedule, make sure they realize how much it is so they can start to think maybe this is an overload. Maybe this is more than I really am comfortable letting my baby have versus them, just believing their doctor when they say, oh, we group them all together now, so now you only need 2 shots.
Right. You need to be educated as a parent. It's your job to make sure you're very well informed on this issue. And then a lot of people 2 other things. A lot of people will say, well, I went to the CDC schedule and that's not how I read it. And so the CDC PDF that you can find directly on their website for the immunization schedule birth to 18 years is kind of confusing. There are a lot of different color blocks. And what they do is they basically have blocks of time that you and your pediatrician can decide between an age range to get a vaccine. So it's not listed always directly under 12 months or directly under 15 months. And that's why it can be kind of hard to read. But the reality that we are seeing in well-visit appointments is you have traditional vaccines that are given at certain intervals. And they don't really think parents are going to come back if you do a couple of these 1 month later and a couple of these 2 months later. So they've gotten into a new routine where they clump everything together because they're afraid parents will not return. So you're getting a lot at 12 months where it wasn't even originally supposed to be like that. It was supposed to be some at 12, some at 15, some at 18. Now we're seeing people giving them all at 12 months, which is a huge overload because you've got in that appointment, you have 4 live virus vaccines just in that one appointment alone.
Yeah.
Right.
And then they throw Hep A, another DTaP, a Hib, and a pneumococcal. And maybe even a polio.
Or a flu, and maybe even a flu
vaccine.
vaccine.
And a flu shot. I mean, they can throw so many together that 12-month appointment, whereas, and a lot of large HMOs will do that.
Right.
Instead of giving you some of those at 15 and some of those at 18 months, like most private pediatricians will.
Or can if the parent comes to them and says, hey, I'd like to spread these out. But for an average parent who doesn't know even how many they're getting, they're not asking to spread them out because they don't even really know what their child's getting. And so you can go to the CDC website directly and look at this PDF. Again, it's a little bit confusing. I encourage people to look at the small print
Oh yeah, totally.
because there's information there that your pediatrician does not know.
Yeah.
Does not know. Recommendations like, and I think we talked about this once, recommendations on the rotavirus vaccine. For example, if your baby is 14 weeks, the CDC says there's no need to start the series at 14
15
weeks.
weeks.
Oh, well, it used to be
15 weeks,
14.
yeah.
Okay.
Yeah.
So 15 weeks. I know for my daughter, she was at 14 weeks when we started. And I'm like, if the guy would have just told me 6 days, like she's breastfed, she's at home, she's not in daycare, no siblings bringing home anything. If I would have waited 6 or 7 days, I could have avoided 3 doses that ultimately went on to really upset her digestive system, like many people that have problems with the rotavirus vaccine that actually causes a lot of digestive distress in those kids. And he didn't tell me anything about that. I mean, we were so close to the point. That's in the fine print at the bottom of the schedule, along with something like DTaP saying after 7 years old, DTaP is not recommended. There are doctors that are not adhering to that rule, and they are willing to give kids DTaP past the point of where the safety studies have monitored. That's a problem. So you as a parent need to get really, really familiar with the schedule, familiar with the fine print. You need to make sure your pediatrician knows all of the fine print and that you're doing everything the best way that you can. But if you look at our infographic, it will be everything you see on that CDC block schedule, but written out like in a linear form, which I think is a little easier to understand. But I promise you with 100% certainty that our infographic is accurate, completely accurate, and it's entirely based on the cdc.gov schedule. It is not exaggerated. It has not been altered. It is not trying to make it look worse than it is. This is literally a CDC schedule written in linear form. So you can be 100% confident that if you were to share this infographic with anyone, including your doctor, it will be 100% accurate, which of course is what we always do. But this schedule this is something people need to know about, and it's a big deal. And then maybe, Dr. Bob, you can talk to the second thing that we hear in relation to the schedule, which is this idea of antigens. You'll see people kind of counter this big number going, well, actually, you're getting much fewer antigens than you used to get. They've just found a way to give them to you differently. So it's actually, quote, less risk, even with the higher number of doses. So maybe you can explain that.
Yeah, that's kind of the those who are vaccine injury deniers and those who push for mandates. They use this as the reason to try to convince you that you don't have to worry that the schedule is expanded. You know, don't worry that the CDC schedule looks so huge now, or our infographic has 2 long lines, lists of tons of vaccines compared to the 80s. Don't worry, because they'll tell you the number of vaccine antigens is way, way less, as if the number of antigens is what's responsible for what makes vaccines safe or not safe.
Right.
And that is so far from the truth. So first of all, the antigen issue comes from one vaccine. It comes from the DTP vaccine, diphtheria, tetanus, whooping cough. The old whole cell vaccine that used to have the entire whooping cough germ in it had, I think, a couple thousand antigens. So I think it was in the thousands. Antigens are basically proteins. So each germ is made up of, many tens of thousands of proteins potentially. And the whooping cough germs were made up of, I think, a couple thousand proteins. And so you literally could say the old whole cell DTP vaccine had a couple thousand antigens in it, and that was a huge load for our immune system to deal with, because the immune system is going to actually attack every antigen. It's going to be reactive against every one of those thousands of proteins. And so you're giving that vaccine and the immune system's going crazy. And that's one reason why so many people reacted so poorly to the whole cell, DTP vaccine. So when they changed it to the acellular, where they took almost all of those antigens out, and I think they were left with maybe 5 antigens out of those original thousands. The new acellular DTaP vaccine, only 5 antigens. Now they could say, well, now our whole schedule, instead of having, many thousands of antigens, it now only has 5 from the acellular. And I don't know how many are in the rest of the vaccine, if there's maybe 100 or so from the whole schedule total. But if you take every single vaccine added up, maybe it's 100 or so antigens. That is technically less than the thousands that used to be on our schedule because of the old, DTP vaccine. But they try to trick you into thinking that makes the new schedule way safer. And there are no data on that. No one has done any research to show that giving 16 vaccines in 69 doses is so much easier on the body because they've reduced the antigens of one vaccine.
One of the
There's
vaccines.
no information on that. So they don't have any research to stand on, but that's where that argument comes from. And so now that you know where that came from, you can better counter that argument saying there's no research showing that the fewer antigen, larger schedule is any safer than the larger antigen, smaller schedule, so to speak.
Well,
if that's how you
ironically,
want to say it.
they don't have any safety information on the schedule at all because they're not
Right.
they're not even studying the schedule, the cumulative schedule. But so again, if somebody says to you, "Well, we have a smaller number of antigens now," just remember they are using that as if that relates to all the vaccines on the schedule. It's relating to one
Right.
vaccine. So out of the 69 doses, even if you were to remove that one vaccine, you still have 51 doses of the same number of antigens that have always existed. So that's really a manipulative argument, I think, a way to make something look like it's not. And the truth is there's really no way to argue for why there are so many vaccines on the schedule. I honestly think there are so many that are optional. And maybe if you live in a certain place with a high prevalence of that and your child's in daycare and not breastfed, and there are a lot of factors then maybe that's a cost benefit analysis for you to do that series. But every single one of these vaccines is not necessary for every single child in the United States. We know many of these are really optional. The number of doses really don't necessarily need to be the way that they are. There's a way to do things differently, but again, nobody's really having that conversation.
Right.
So you can find our infographic on immunityed.org. You can find the CD schedule on cdc.gov and just search childhood immunization schedule. They are both saying the exact same thing, just in different forms, and it's completely accurate. We also list, I put the pregnancy doses in italics at the beginning so that you're aware that those are there. But again, the number is 69 doses on the childhood schedule for 2020, and we have our new infographic up for that. And hopefully this helps clear up just a little bit of why and how you count them and all the questions I tend to get on my posts whenever I write about this. This was also a truth post number 36. If you want to see this on my Facebook, you can hashtag search in your Facebook bar. Hashtag truth post any of my numbers, 2, 3, 4, 5, 6, all the way up to 40, I think is my last one. So you're going to have a really hard time going down my feed to get to them. So if you just in the Facebook search bar, hashtag truth part 36, you'll come to this post, and hopefully that clears it up for you.
Now you tell me you can search Facebook posts. You know how many times I scrolled down?
I have a long feed too, because I post a lot. Anyway, that's it for this one. We're going to hit you with the next episode about people who say vaccinate your damn kids and what that means. And that's going to be our next one. So you won't want to miss that as well. Thank you guys for tuning in to the Vaccine Conversation with Melissa and Dr. Bob.
We're gonna be the peace we wanna see in the world. Yeah, be the peace we wanna see in the world. Yeah, be the love we wanna see in the world. Be the joy we wanna see in the world. Be the change we see in the world.
The information in this podcast is for entertainment purposes only. It is not intended as medical advice. Always consult your healthcare professional for information on vaccines and infectious diseases.